Welcome to SR Pharma Gyan. Today we are going to focus on sedative and hypnotics. So in sedative and hypnotics, we are also going to focus on the mechanism of action of benzodiazepine, barbiturate, melatonin receptor agonist, dual roxin receptor antagonist, tricyclic antidepressant agent. Now coming to the sedative and hypnotics, it is an important category of the drug used worldwide for the treatment of different sleep-related disorders and other CNS disorders. So, it is in the current age, there is a much emphasis on the quality and quantity. Quality and quantity of sleep. Because a number of diseases are associated with the irregular sleep and stress. So, sedative and hypnotics are used to reduce the tension, anxiety and induce the calm, and also they induce or encourage sleep. Now here we can find the two terms, one is the sedative term, another is the hypnotic term. Now, in case of the sedative, they reduce the tension and anxiety. They'll reduce the tension and anxiety and they will induce the calmness. While hypnotics, they also reduce the anxiety, tension and induce the calmness, but through encouraging the sleep or through inducing the sleep. So these are the drugs, hypnotics drugs, they will induce or encourage sleep. This category of the drug, they depress the CNS function, they reduce the CNS function. They inhibit excessive and abnormal activity of nerve cells. So, hyper-responsiveness or excessive abnormal activity of the nerve cell in brain, they will be reducing, which help to relieve from stress. These are drugs widely used for the treatment of the insomnia as sedative, anxiolytic, muscle relaxant, etc. Some of the examples are the benzodiazepine, barbiturate, melatonin agonist are this kind of drugs. These sedative and hypnotics, they can produce the calmness or quietening effect in the low doses, while in larger doses they induce the sleep. So larger dose, they can act as a, in large dose they will act as a hypnotics, and in less dose or low dose they will act as a sedative. Though hypnotics, they will induce the sleep, as we have told, they will induce the sleep, but they do not alter normal sleep pattern. They do not alter normal the normal sleep pattern, the hypnotics. Now coming to the what are the general uses of sedative and hypnotics drugs. They used in the treatment of the insomnia. Now insomnia is a common problem nowadays. This problem, it is nothing but it is either the hard to fall asleep or hard to stay asleep. So for the treatment of the insomnia, this category of the drugs are very useful. They are also useful to reduce the anxiety and aggressiveness. To reduce the anxiety and aggressiveness, these drugs are used. They are also used as a muscle relaxant. Since they depress the CNS, they are also act as a muscle relaxant, centrally acting. They also used as an anti-epileptic agent for the treatment of the epilepsy or the convulsion. This category of the drugs can be used for the control of mania. So this is also another important uses of sedative and hypnotics. So they are used for the treatment of the mania. These are the drugs also used as a pre-anesthetic medication, because after administration of these drugs, before the anesthesia, general anesthesia, they will promote the sleep. Clear? They will promote the sleep, or they will useful to maintain the anesthetic state after administration of anesthesia, general anesthesia. Now, common side effect of sedative and hypnotics includes confusion, drowsiness, somnolence. This is the drowsiness state. It is sleepiness or the drowsiness state. Of course, as these are the drugs are used as a sedative and hypnotic, so they are producing the drowsiness. It may occur the respiratory depression in large doses. They may cause the respiratory depression, and long-term use may cause the dependency. Long-term use may cause the dependency. Now coming to the what is the difference between a sedative and a hypnotic drug? So difference between the sedative and hypnotics. These are the drugs. It is reduce the excitement, sedative, and exert calming effect. So as we have told, reduce the excitement and exert the calming effect without inducing sleep. So this is very, very important. Without inducing sleep. So they do not cause the sleep. They do not induce the sleep. Sedative. Though drowsiness may be produced, but they will not induce the sleep, but they will reduce the excitement and exert calming effect by depressing the central nervous system. While hypnotics, they will induce or maintain the sleep. They will induce the sleep or maintain the sleep similar to the normal arousable sleep. As we have told that these hypnotics, that do not alter normal sleep pattern, so they will maintain the sleep similar to that of the normal sleep. Clear? Similar to that of the normal sleep. They will produce the drowsiness. So these are the drugs also produce the drowsiness because they are inducing the sleep, and they will encourage the onset. And they will also maintain the state of sleep. So they are affecting in the two way. They are encouraging the sleep as well as that they maintain the normal arousable sleep. Sedative, they decrease CNS activity. Already we have told they are CNS depressant, so they'll decrease the CNS activity. So decrease responsiveness any level of the stimulation. So whenever there is a excessive stimulation, there is a hyper responsiveness into the nerve cell of the CNS. So these drugs are decrease the responsiveness. It is also associated with the some decrease in motor activity. Already we have seen that they are used as a muscle relaxant because they are acting as a CNS depressant, so they are decreasing the motor activity. That's why they are used as a centrally acting muscle relaxant. They may act as a centrally acting muscle relaxant like that of the diazepam. While hypnotics effect involve more pronounced depression on the CNS. So of course that it is producing the sleep, so it is depress the CNS more than that of the sedative. So more than that of the sedative, it will depress the CNS. And a hypnotics at lower dose may act as a sedative. So in low dose the drugs may act as a sedative, and in high dose they may act as a hypnotic. Same drugs, clear? Same drugs. So their mechanism of action is same, only the extent of effect in the CNS or the extent of CNS depressant activity varies. Now coming to the classification of the sedative and hypnotics. Now sedative and hypnotics, mainly we are classifying into benzodiazepine, barbiturate, non-benzodiazepine or the Z drugs, melatonin receptor agonist, dual orexin receptor antagonist, tricyclic antidepressant, and miscellaneous category. Now coming to the benzodiazepine further it subclassified into the long acting, which is the flurazepam, intermediate acting alprazolam, long acting triazolam. Barbiturate again subclassified into long acting phenobarbital, intermediate acting amobarbital, short acting pentobarbital, ultra short acting thiopental. Non-benzodiazepine, which is also known as a Z drugs, these are the zolpidem and zopiclone type of drug. Now coming to the melatonin receptor agonist. So these are the drugs are Ramelteon and Tasimelteon. Dual orexin receptor antagonist is Suvorexant, tricyclic antidepressant doxapine. Miscellaneous type of drugs are chloral hydrate, paraldehyde type of drug. Now if we see these different categories, these are the drugs, that means benzodiazepine, barbiturate and non-benzodiazepine or the Z drugs. These are the drugs produce their effect through GABA A receptor. GABA A receptor. So these are the drugs, they produce the sedative effect through GABA A receptor. While this category of the drug, that means melatonin receptor antagonist, dual orexin receptor antagonist, tricyclic antidepressant, etc., they have their own mechanism which is not related to the GABA A receptor. Now we are going to focus on the barbiturate and benzodiazepine. This category of the drug can cause dose dependent depression of CNS. Increase the dose, depression capacity also enhances. In current practice, barbiturates have largely been replaced by the benzodiazepine. Why? Because barbiturate has high risk of causing addiction, high risk of causing the addiction or a fatal overdose. So if you are increasing the dose, it can cause the death also. So in case of the benzodiazepine and barbiturate, as we have told that they cause the dose dependent CNS depression, dose dependent. Now dose dependent. If we increase the concentration, what is happening? Drowsiness or sedation effect. In the low dose, it will cause the sedation effect or the drowsiness. In increase the dose, if we increase the dose, it will cause the hypnotic effect. It will cause the hypnotic effect or it will produce the sleep. Further, increase the dose, it may cause the unconsciousness. It may cause the unconsciousness. Further increase into the dose, it can cause the coma. It can cause the coma. And further enhance the dose, it may cause the fatal effect. It may cause the fatal effect. So as we have told that barbiturates, due to their high risk of causing addiction or the fatal overdose, they have been replaced. Now we'll see about the comparative effect, CNS effect between the barbiturate and benzodiazepine. So if we plot the graph between the CNS effect and increase in the dose, and we are classifying the different state of CNS effect: sedation effect, that means anti-anxiety, selective anticonvulsant or the muscle relaxant activity in the first stage or the low dose. Next is the hypnosis. Next is the general anesthesia or the unconsciousness, medullary depression, and next one is the coma. So first we will see about the barbiturate. So if we can see the graph, if we increase the concentration, of barbiturate type of the drug, first it will produce the sedation, next hypnosis, next is general anesthesia, medullary depression, and then coma. So it can cause the fatal effect if we increase the dose, or in case of the overdose it can be fatal also. While in case of the benzodiazepine, it is relatively safer than the barbiturate. It is relatively safer than the barbiturate. So in this stage, if we can see that after the sedation and then produce the hypnosis effect, if we increase the dose, they also cause the general anesthesia, but in this stage, they will produce the further increase into the dose, they will cause the medullary depression. Clear? Medullary depression. So they are not like that of the barbiturate. Clear? Or they are relatively safer than the barbiturate. Now coming to the mechanism of action of drugs act through GABA A receptor. GABA A receptor. So these are the benzodiazepine, non-benzodiazepine or the Z drugs, and barbiturate. Now non-benzodiazepine or the Z drugs, why it is also called as Z drugs? Because a number of the drugs under this category, it is starts from Z, so it is also known as the Z drugs, but not all the drugs, of course. Now what is their mechanism of action? So they act on the GABA A receptor. So in our previous class we have discussed about the GABA receptor. Clear? GABA receptor, you can go through the lecture of our previous class to know details about the GABA A receptor. GABA receptor, it is mainly three category. One is the GABA A, GABA B, and GABA C. And this GABA A, it is a ligand gated ion channel. Ligand gated ion channel receptor. It is found in the CNS, mostly in the high concentration into the thalamus, hypothalamus, and hippocampus area. It is composed of the total 5 subunit, but there are presence of the 19 subunit, 19 total 19 different subunits are present. Out of this 19 subunit, this ligand gated ion channel, a particular ligand gated ion channel, it is composed of the 5 subunits. So what are the 19 subunit? As we know that 6 alpha subunit, we can see that 6 alpha subunit, 3 beta subunit, 3 beta subunit, 3 gamma subunit, then 3 Rio subunit, one delta subunit, one pi subunit, one epsilon subunit, and one theta subunit. So total 19 subunits are there. Out of 19 subunit, it is composed of the 5 subunit. And most common isoform in the adult is 2 alpha, 2 beta, and 1 delta subunit. Now, in this receptor, it is enclosing a chloride channel. If you are seeing that GABA receptor, it is enclosing the chloride channel, and also in the GABA A receptor we can find that they composed of though 5 subunit, but they also have the 4 hydrophobic. Each subunit they consist of 4 hydrophobic trans domain. These are the TM1 to TM4. So total 5 unit, and each subunit is composed of the 4 hydrophobic domain. So total 20 hydrophobic domain is there, and TM2 domain or transmembrane domain, it is responsible for the formation of pore of chloride channel, this chloride channel. For details you can visit our previous lecture, that is the GABA A receptor. The link is given in the description box. Now in this receptor, GABA is a endogenous ligand. It is bind to the beta alpha beta subunit interface. It is bind to the alpha beta subunit interface. These are the GABA binding site. After binding, when the GABA it will bind to this their specific site, it will open the chloride channel. So GABA binding, it will cause the open chloride channel. As a result, chloride it will come inside and it will cause the hyperpolarization. It is nothing but the depression effect. So what is happening here? This either the barbiturate, benzodiazepine, or non-benzodiazepine or the Z drug, they will bind to the distinct site in the GABA A receptor. They will bind to a distinct site of a GABA A receptor. It will cause the activation of the GABA A receptor. It is called the activation of GABA A receptor. And while this GABA receptor it will activated, this chloride channel it will be open. So they increase the opening frequency of the chloride channel. So chloride channel it will be open. Once the chloride channel it will be open, so chloride ion comes inside the cell. Why? The concentration of the chloride ion it is more in the extracellular membrane. So chloride ion it will come inside. Since negatively charged chloride ion it is coming inside, so membrane potential it is goes down. Which results the hyperpolarization. It will cause the hyperpolarization because negatively charged ion coming inside the cell. Since It is, if it is cell, negatively ions are coming inside the cell, so this membrane potential, it will comes down. So if it is the action potential during the hyperpolarization, it will be like that, it will be like that, it is come down from the resting membrane potential, which is known as a hyperpolarization. So due to this hyperpolarization in the post-synaptic neuronal membrane, hyperpolarization due to the opening of the chloride channel, hyperpolarization in the post-synaptic neuronal membrane, it will cause the CNS depression. You can also visit to our previous class on the action potential to understand this mechanism in detail. The link is given in the description box. Now, we already have told that GABA binding site is the alpha beta, clear, alpha beta. So this is the GABA binding site. This is the GABA binding site. That is the alpha beta interface. Benzodiazepine, it is act as a positive allosteric modulator. Allosteric modulator. What is mean by the allosteric modulator? These are the substance that bind to a receptor. So it is, of course, it will bind to a receptor to change the receptor response to the stimulus. Receptor response means opening of the chloride channel. Here it is means by the opening of the chloride channel. So whenever the stimulus, it will cause the opening of the chloride channel, but they will bind to the distinct site. They will bind to the distinct site. That means the binding site of the allosteric modulator, it is different from those used by the specific ligand. It is used by the specific ligand. Now what does it mean? See, here also we are telling that it is like, for example, it is bind to the interface of alpha and gamma, alpha and gamma interface. These benzodiazepines are, it is binding, so it will bind to this GABA channel, but it will not bind to the same site where the GABA is binding. So that is the uh, allosteric modulator, but they will promote the opening of the chloride channel. So they will enhance the GABA induced, they will, after binding, they will enhance the GABA induced chloride ion flux. They will induce the GABA induced, they will cause the GABA induced chloride ion uh, flux. So they enhance the frequency of, they will enhance the frequency of chloride channel opening. They will enhance the frequency of chloride channel opening. So binding site, we have seen that, that is the alpha gamma. In case of the barbiturate, this is also allosteric modulator. Their binding site into the alpha beta and gamma beta interface, gamma beta interface. So they'll enhance lifetime of the chloride channel opening induced by the GABA. So they will induce, means they will increase the time of chloride channel opening, increase the time of chloride channel opening, which is caused by the GABA. So more amount of the chloride it will inside, it will cause the hyperpolarization. At high concentration, barbiturate at high concentration directly increase chloride conductance. They will directly increase the chloride ion conductance. So this is the GABA mimetic action, GABA mimetic action on the high concentration, in the high concentration. Otherwise they will increase the opening time of the chloride ion channel, which is induced by the GABA, and in high concentration directly increase the chloride ion conductance, GABA mimicking action. They also inhibit calcium dependent release of the neurotransmitter. We know that calcium is a positively charged, so they will inhibit the calcium dependent release of the neurotransmitter. So due to the excitement, there is maybe the so many neurotransmitter it may be released, which may cause the excitement. So that will also inhibited by the barbiturate. And zolpidem, it is bind to the alpha 1 subunit also, clear, also the alpha 5 subunit, and that is also the allosteric modulators. So you know that these are the drugs after binding to the GABA receptor, they will bind to the specific site or distinct site which is not similar that of the binding site of the GABA. Then they will increase the opening frequency of the chloride channel. So chloride ion come inside the membrane or the cell, and it will cause the hyperpolarization of the postsynaptic neuronal membrane, which results the CNS depression, So this is the mechanism of action of barbiturate, benzodiazepine and non-benzodiazepines. Now we are going to focus on the drug which do not act through GABA A receptor. So first category of the drugs are the melatonin receptor agonist, Ramelteon and Tasimelteon. Now we know that melatonin, it is a hormone primarily secreted by pineal gland, which is primarily secreted by pineal gland at night and regulate sleep wake cycle, and it's regulate sleep wake cycle. Melatonin plays important role in biological clock, also for maintaining biological clock synchrony. Melatonin secretion by pineal gland has a circadian rhythmicity which regulated by the suprachiasmatic nucleus or SCN or SCN. Now this SCN function as timing regulator of melatonin. So SCN function as timing regulator of melatonin. Now if we see about the receptor, so melatonin receptor are mainly two types, that is the MT1 and MT2 receptor. MT1 and MT2 receptor. Both of these receptors are GPCR or G protein couple receptor. G protein couple receptor. MT1 related to sleep promoting effect of melatonin. So this MT1 receptor, MT1 receptor, this is related to sleep promoting effect of the melatonin. Whereas MT2 receptor plays key role in melatonin resynchronizing activity. Now coming towards the MT1 receptor, now MT1 receptor activation of MT1 receptor, when the melatonin bind to this MT1 receptor, its activation results inhibition of adenyl cyclase. So it will cause the inhibition of adenyl cyclase. As a result, formation of cyclic AMP also reduced. As a result, formation of cyclic AMP is reduced. In turn, there is a decrease in PKA, protein kinase A activity, decrease in protein kinase A activity, which in turn hinder phosphorylation of CREB. CREB means this is the cyclic AMP responsiveness element binding protein. This MT1 receptor activation also activates phospholipase C, which affect ion channel and regulate clear, ion flux inside the cell. When melatonin bind to empty receptor, it inhibit adenyl cyclase. So cyclic AMP reduction, decrease into the pKa activity, and decrease into the phosphorylation of CREB. MT2 activation also reduce or hinder guanyl cyclase. Therefore, cyclic GMP. There is a reduction of cyclic GMP. Clear? Cyclic GMP. MT2, after activation, it is probably increase protein kinase C activity, and due to this it will lead to the ion flux inside the cell. Now, as we have told about the two drugs under this category, that is the Ramelteon. Now in case of the Ramelteon, it is mainly used for the treatment of insomnia. And Tasimelteon, it is used for sleep wake disorder. It is used for the sleep wake disorders. Now, Ramelteon and Tasimelteon both are the melatonin receptor agonist. Both are the MT1 and MT2 receptor agonist. So they act as a agonist in MT1 and MT2 receptor, thereby used for the treatment of sleep wake disorder or for insomnia. Next is dual orexin receptor antagonist, that is the Suvorexant. Now know that orexin is a neuropeptide. Orexin is a neuropeptide which released from the presynaptic terminal. Now mainly there is a two isoform of the orexin A and orexin B. Orexin, which is also known as a hypocretin, and regulate arousal, wakefulness, our mood, appetite, and lipid metabolism. So it play important role in regulation of the arousal, wakefulness, mood, appetite, and lipid metabolism. So orexin isoform orexin A and orexin B, and there is a two orexin receptor, OX1 and OX2. Generally, orexin A and orexin B both it is binds to the OX1 receptor, whereas orexin A it is also bind to the orexin 2 receptor. So orexin A binds to both OX1 and OX2 receptor, whereas orexin B mainly bind to the OX1 receptor. Orexin A binding to both OX1 and OX2, as we have told, while the orexin binds mainly to the OX2 receptor. And Suvorexant, this drug, which is dual orexin receptor antagonist, blocks both OX1 and OX2 receptor. Clear? Both Orexin 1 and Orexin 2 receptor, through which it promotes the sleep, through the binding inhibition of orexin A and orexin B. So it will inhibit their binding, this whenever the drugs, it will be bind to this, because this is a antagonist, clear. So due to this, sleep it will be increases, and anxiety or the panic like behavior will be reduced. It will be reduced when the Suvorexant act as a antagonist in both OX1 and OX2 receptor. Category of the drug is the tricyclic antidepressant doxapine. Now we know that tricyclic antidepressant type of the drug, it is a important category of antidepressant drug, which increasing the level of the noradrenaline and 5-HT, noradrenaline or 5-HT or the serotonin. You know that these are the catecholamines. It is very important for our body, and also you can say that their depletion can cause the depression in human. So tricyclic antidepressant, it is promotes the NA, that means noradrenaline and 5-HT serotonin. In addition to the relieving depression, because tricyclic antidepressant act by increasing noradrenaline and 5-HT. So in addition to the relieving depression, tricyclic antidepressant also block the effect of histamine. So they also block the effect of histamine. Now doxapine, treatment of the depression, it is used for the treatment of the depression and depression with insomnia and anxiety disorder. In case of the depression which associated with the insomnia and anxiety disorder, in such condition also doxapine is useful. And in low dose, when the doxapine it is given as a low dose, it is having the high selectivity of H1 receptor. We know that H1 antihistaminic drugs are also responsible for the CNS depression activity. Of course, the first generation, generally the first generation of the H1 antihistaminic drugs having the CNS depression activities. Chloral hydrate. So it is used as a short-term treatment of the insomnia. It is used as a short-term treatment of the insomnia only in few countries, because it is largely displaced in the mid 20th by the barbiturate. And as we have told, nowadays benzodiazepine is used more compared to barbiturate. So precise mechanism of these drugs, it is still unclear, but it may act analog to the ethanol. It may act analogs to the ethanol and on the central nervous system by increasing the membrane permeability, which leads to the sedation or sleep, So these are the different category of the drugs which is used for the treatment of different disorders, conditions associated with the sleep. And the drugs, mainly barbiturate, benzodiazepine, it is used for the treatment of the other condition like epilepsy, as a muscle relaxant, pre-anesthetic medication, etc. So this is all about the sedative and hypnotics. So hope you have understood it. If any doubt, any question, you can write to us. Give your comment in the comment section, so we'll definitely reply you. Thanking for the support to SR Pharma Gyan. Thank you.